This is Dr. Raj. There is lots of information out there right now about COVID-19 virus, and I want to make sure that you have the most up-to-date and correct information about this virus. So this virus is an obligate parasite. And what that means is that it feeds off of your immune system. It attacks your immune system. So those of you watching this video, it's probably because you have been to Sole Focus in the past, and very likely you are immunocompromised. You might be suffering with type 2 diabetes, a thyroid issue, whether it's hyper or hypo, Hashimoto's, or early stage cognitive disease. And I want you to know this video is for you because you are predisposed and at high risk for this virus because, again, it attacks those that are immunocompromised. So I'm going to tell you and give you things today that not only I am doing, but I have my family doing as well to help prevent getting this virus and fight it off should you contract it. So first and foremost, prevention is the key. We need to employ preventative healthcare, preventative measures so that you can keep your body strong. What doesn't kill you makes you stronger. So what are those things? First, the CDC guidelines. You want to make sure that you are practicing social distancing, washing your hands frequently. You want to make sure that you're not touching your face. If you should have to go outside, when you come back in the house, make sure that you strip the clothes off of your body, throw them right into the washing machine and shower and disinfect your body, disinfect your car, disinfect your house. Unfortunately, social distancing is the only thing that the CDC has recommended that you probably don't do on a regular basis anyway. But there is more. You need to build your immune system. How do you do that? The first thing is diet. You want to make sure that you're eating plenty of natural whole foods, fresh whole foods, and lucky for you, in the supermarkets, most of the fresh vegetables and fruits are available. It's all the processed foods that people have been buying up. And that's also one of the reasons why Americans in general are most susceptible to this disease because they are immunocompromised. 80% of our diet here in the States are processed foods. So you want to stay away from them. You want to eat lean meats, lean proteins. You want to snack appropriately. Stay away from the processed garbage, the chips, and have a lot of nuts and seeds. Drink plenty of water, half of your body weight in ounces of water per day. And eat healthy. Don't take this as an opportunity to gain weight and sit on the couch, which brings me to exercise. So you can go outside, and I encourage all of my patients, my family, to go outside and take long walks together, ride a bike. You can still practice social distancing while doing that. If you don't want to go outside, then work out at home. Do calisthenics, jump rope, run in place, use body resistance, but make sure that you are exercising, making your body strong, which doesn't kill us, makes us stronger. And then also mental attitude, limit your news. You want to make sure you stay informed, of course, but maybe twice a day and pick those times. And the other times of the day, do feel-good activities, whether it's watching a feel-good movie, not Pandemic, not Chicken Little, not The World is Coming to an End. Do a puzzle, stimulate your brain, and so you can start thinking logically from a place of the logical mind and not necessarily from fear. Again, this is a virus that attacks your immune system, and there are two ways to combat a virus. There is the virus-directed approach. The virus-directed approach is like the flu. And what you do there is you develop a vaccine. By the way, a vaccine is probably 12 to 18 months away for this virus. And like the flu, it will mutate and change over time. So once we do have a vaccine, it's going to take some work to make sure that we have the right strain and keep working on that until we get it right. The Other way is the host-directed approach, and that's what I'm here to talk to you about, and why it's so important is because it builds your immune system to help prevent you from getting sick in the first place. My office has put together an antiviral immune boosting kit. And what this kit does is 4 things. The first thing it does is it helps to prevent you from acquiring this virus to begin with. All naturally, with homeopathic supplementation to build your immune system. The second thing it does is it helps to inhibit the replication of this virus should you contract it. Very, very important, because if this virus is in your system and it can remain dormant and symptom-free for several days, you want to make sure that you're taking supplements that, should it be in your system, you kill it and you inhibit the replication of the virus. The kit also helps to support all of your cells, making them strong and resilient. And lastly, of course, the most important is it builds your immune system. So again, this is something that I am taking, my family is taking, and I am recommending for all those that I love and care about, and that includes you. If you were immunocompromised, this time now more than ever is important for you to work on you and build that immune system. Please scroll down below and choose the immune building kit that is perfect and fits for you and your family. Thank you. This is Dr. Raj reminding you that what doesn't kill you makes you stronger. Yours in good health.